Surgeries give millions of people a second chance at life every day. Fortunately, we live in the age of advanced science and medicine that's made it possible for humans to carry out miraculous surgical wonders. Who would have thought we'd be making the impossible possible? It's exciting to think about, isn't it? So sit tight, because in today's video, we bring you exciting stories of the most unusual surgical procedures that changed the course of medicine and history. The case of Jessie Hall. In June 2009, doctors brought Jessie Hall from Texas to Johns Hopkins Hospital in Baltimore for a life-saving surgery. Jessie was only 6 when she started to have multiple seizures a day. Her parents learned that she had a disease on the right side of her brain called Rasmussen's encephalitis. Rasmussen encephalitis, also called Rasmussen syndrome, is a rare, progressive, chronic inflammation of one side of the brain. If left untreated, it could lead to death. A rare procedure called a hemispherectomy was considered the best possible treatment for Jessie. The procedure, by the world-renowned neurosurgeon Ben Carson, was a 7-hour-long intense surgery, where surgeons carefully removed the right half of her brain. The hospital sent portions of the infected brain for lab tests, where doctors confirmed that it was Rasmussen's. After the surgery, Dr. Carson explained that the skull immediately fills with fluid in the space the right brain used to occupy. Then, with time and rehabilitation, the left brain will take over the duties of the right. Jessie is left with some weakness on her left side, her left arm, and left peripheral vision. But like she was assured, she adapted. Jessie said it's pretty much normal to her now. When she's in the classroom, she sits on the left side of the room so she can see the teacher a little better. In an interview in 2011, 12 years after the surgery. The rebirth of Macie Hope. The case of Macie Hope McCartney is a strange and rare one. It's not every day you hear a person being born twice. When Carrie McCartney was 23 weeks into pregnancy, she and her husband Chad discovered that their baby had an enormous and deadly tumor growing out of her tailbone. An ultrasound revealed the non-cancerous, grapefruit-sized mass was sucking the blood out of the baby's supply that could eventually kill her before she was born. This condition, called sacrococcygeal teratoma, which affects 1 in 40,000 babies, was considered fatal by doctors. Surgery needed to happen as soon as possible, but experts revealed a less than 10% chance their child would make it. A nerve-wracking situation for both the expecting parents, but Chad and Carrie never lost hope. The first birth was about 6 months into Carrie's pregnancy at Texas Children's Fetal Center, one of the best hospitals in the world that specialize in prenatal surgery. In the 4-hour surgery, the doctors could remove the back part of the fetus from the uterus, remove the tumor, and place it back in the womb. The most critical part of the surgery was ensuring the uterus was watertight so that the amniotic fluid wouldn't leak. The doctors were able to put the baby back into the mother's womb safely. Then, 10 weeks later, on May 3, 2008, Macie Hope McCartney was born again, in a perfectly healthy state for the second time. Because doctors told the parents that the baby had a 10% chance of surviving, they decided to give the infant a name fitting of their hopeful journey. In an interview with Today, Chad said they wanted to pick a name that would be appropriate, so they named her Macie Hope, because that was all they felt they had. The 4-day surgery. February 4th, 1951 was the first day of what would become a 4-day operation, which is currently the longest surgery in U.S. history. 58-year-old Gertrude Lewandowski from Michigan started gaining weight after her husband's passing. When she reached 9 feet in circumference, all she could do was sit on a solid chair and peel a few potatoes while her 17-year-old son took over the housework. Local doctors discovered an undiagnosed ovarian cyst in Gertrude, which was the cause of her weight gain. Along with this, she also developed a heart problem. Gertrude's doctors feared they could not remove the tumor without causing heart complications. Another physician, A.G. Gould, believed that the cyst was provoking a strain on her heart and suggested that the removal of the cyst could cure Gertrude's cardiac issues. Dr. M.S. Roberts, a surgeon from Chicago, proposed a profoundly different method of removing the cyst, giving a highly vulnerable Gertrude the best odds of surviving this dangerous procedure. Roberts believed that draining the tumor would reduce the stress on the heart by preventing a rapid pressure drop. Gertrude arrived at the hospital weighing about 620 pounds. This number was a mere estimate because, while standing 1 foot on each of 2 side-by-side scales, Gertrude still maxed out the 600-pound weight limit. During the 96-hour procedure, Roberts slowly drained fluid from the cyst. In total, Roberts withdrew about 200 pounds of fluid from the cyst. Roberts then removed the withered cyst, which weighed about 150 pounds. Following the procedure, which ended on February 8, 1951, Gertrude weighed 308 pounds, almost half of her pre-surgery body weight. A few months later, she underwent another operation to remove the 50 pounds of excess abdominal tissue that covered the cyst. Face transformation. Pascal Kohler, a Frenchman, had already undergone dozens of operations to reduce the massive tumors on his face, caused by neurofibromatosis. This extremely rare condition causes tumors to grow on a person's face, disfiguring it beyond recognition. With his condition, he could barely even eat. After having awful experiences with strangers, Kohler decided to live the life of a recluse. But on January 2007, he got a call that was about to change everything. They had found a face donor for him. After 16 hours of surgery, Kohler came out with a new face. Laurent Lanterry, the head of plastic surgery at Henri Mondor Hospital near Paris, says that almost all of Kohler's face was replaced with that of the donor, including the lips, cheeks, nose, and mouth. Lanterry also claims it was the world's first full face transplant. The doctors cut his skin and replaced it with a new one, painstakingly connecting arteries, veins, and nerves. However, Kohler's bone structure had not been altered, so he looks nothing like the face donor. This was the 3rd face transplant ever done. The In-utero Surgery. Kylie Bolin was 18 weeks pregnant when doctors told her that her unborn baby might lose her feet. Kylie and her husband Terry had 2 options. A. Doctors could operate while baby Leah was still in the womb, a procedure that could risk both the mother and the child. Or B. They could just let everything be and let Leah face a lifetime of walking aids and difficulty. An ultrasound showed that the baby had amniotic band syndrome, a rare condition caused when the amniotic sac's finely webbed lining tears away and wraps around the fetus's limbs. 2 amniotic bands wrapped around each of the baby's ankles, cutting off blood supply to the lower legs. This condition occurs in 1 in every 12,000 live births, and if left untreated, it can result in limb amputation or, in the worst cases, death. The doctors at Monash Medical Center decided that they would have to operate on her at 2 weeks in utero, the earliest operation conducted on a fetus in Australia and possibly the world. Typically, doctors wait until 28 weeks to do a surgery on a fetus, but without intervention, the baby would have lost both her feet. Surgeons inserted a 2mm operating telescope into Kylie's womb and used a laser and electric current to cut the bands on the baby's left leg, thereby saving it. Unfortunately, the right leg was already infected and inoperable. The baby was only 7 inches long at the time of the operation. 8 weeks after the operation, on January 24th, Kylie gave birth to Leah, 2.5 months premature. When Leah was 4 days old, microsurgeon Dr. Chris Combs and Associate Professor Doonan of the Royal Children's Hospital operated to repair her right leg, which had been dangling from a tiny artery. Lastly, self-surgery. Dr. Kane spent most of his career as chief surgeon at Kane Summit Hospital, a hospital founded by his mother. He also worked as a railway surgeon for 5 different railroads for several years. He performed an estimated 1,000+ field operations between 1898 to 1900, often in unsanitary conditions far away from hospitals. Evan O'Neill Kane of Kane, Pennsylvania, was an American physician and surgeon. He wanted to prove that the primary general anesthetic at the time was being used far too often, when a less dangerous local anesthetic could be substituted. For his test subject, he used himself, removing his appendix, using only local anesthetic by propping himself up on the operating table with a mirror over his abdomen. With 3 other doctors in the operating room as backup, Kane made the large incision needed to remove the appendix, and his assistants sutured him. This was before new techniques allowed doctors to make small Band-Aid-sized incisions for appendix removal. The doctor recovered nicely. In January 1932, at 70, Kane performed an even more complicated surgery on himself to remove an inguinal hernia. Because of the proximity to the femoral artery, it was a particularly delicate operation. Kane performed it in just under 2 hours. Reportedly, he was relaxed and joking, even as he sutured within millimeters of the vital blood vessels. Wow, wasn't that interesting? Want to hear more unusual stories? Or maybe you're interested in unique places? Let's keep the conversation rolling. Watch 10 unusual genetic mutations of the human body, or 16 unusual restaurants from countries around the world. Go ahead, click on one, or better yet, watch both. Which of these stories did you like the most? Let us know in the comments.